Hi, I'm Colleen Winecombe, new co-host of Beyond the Stethoscope, a podcast that brings you inside the conversations shaping healthcare across Pennsylvania, Delaware, and Maryland. On each episode, we feature physicians, clinical leaders, and frontline colleagues, each sharing insights about how care is evolving and what it means for patients and families in our communities. Today, we're talking with someone who sees healthcare through a very human lens. Leanne Harris is Chief Nursing Officer of Trinity Health Mid-Atlantic. She's here to discuss what patients notice, what they worry about, and what makes them feel safe and cared for. Leanne, I'm really excited for this conversation.
Thank you so much for having me. I appreciate it.
I'm excited for it. So nursing is considered by many to be the backbone of the healthcare industry, but I don't think a lot of people fully appreciate the major role nurses play in shaping healthcare's future. So I'm looking forward to diving into that today with you.
Wonderful.
And let's start with how patients experience nursing care. For patients, care is all that matters, right? It's how a nurse or other healthcare provider makes them feel, and that can be physically or mentally. So as a nurse and a nurse leader, what is one of the most common questions you hear from patients?
Besides, when do I get to leave?
Besides that.
I would say probably the most common question is, how am I doing? You know, what is happening with my care? Oftentimes patients are concerned about how are things going? Am I going to be okay? And as a nurse and as a nurse leader, that is my job and the job of the team to make the patient feel comfortable in their environment, comfortable with the care that they're receiving, so that they know that they're going to be okay in our environment.
So what is one thing you wish more patients understood about what nurses do? And how about what happens behind the scenes in their care?
Sure. I think the thing that I would want patients to really understand is that nurses, it's not just about administering medication. A lot of times people think that's the only thing that nurses do. They come in, they take your vitals, and administer medications, but there's so much more to what a nurse does in providing care to patients. And so the things that happen behind the scenes includes the coordination of care. And so I kind of look at the nurse as sort of the air traffic controller of care for patients. And you see them working with physicians, pharmacists, the lab, to make sure nothing's missed, to make sure that that patient is having is safe, so that all things are aligned when the patient comes to us in our care. So they're really an air traffic controller of healthcare.
I love that analogy.
Yeah.
That's very good. Did you just think of that?
No, I've actually, when I fly quite often, at least here lately, and I think about the role of the air traffic controller.
It's very important.
They are the person who keeps the planes safe and make sure you get to the ground safely. It's not just the pilot. And so in this instance, it's not just the physician, it's the nurse, that air traffic controller. It's not just the pharmacist, it's just not just the housekeeper.
Yeah.
And you need that nurse to coordinate all of that care.
Yeah. That's great. Are there any common misconceptions about nurses or nursing in general that you'd like to clear up?
I would say, maybe one common misconception is what we talked about a little bit earlier, is that, they're here to just administer medications. I look at it like this. Patients go to physicians in their office for physician care. They come to hospitals for nursing care.
Yeah.
And the nurses are the ones that are there with them 24 hours a day, 7 days a week. As much as we love our physician colleagues, they are able to come in and leave. And it requires that nurse to be there 24/7, providing that information back and forth to the physician to make sure that the patient is receiving exactly what they need in their time of need.
Yeah, that's a good point.
Yeah.
If someone is trying to decide where to seek care, what advice would you give them?
I would say that is where you go to your physician.
Okay.
Right? They're going to guide you. One of the things that if I were going to tell patients, make sure you're receiving care, the right level of care for the right situation. Unfortunately, a lot of times patients will come in and to our emergency departments when really the care that they needed was in a physician's office. And so it saves them time. In some cases, it saves them financially to make sure they're receiving the right care at the right time by the right source. And so that I think that's extremely important, that patients go to the right place to get their care.
And start with the physician.
And start with their physician, with their primary care provider.
What is one thing, in your opinion, that differentiates a good nurse from a great nurse?
I would say a good nurse comes in every day, provides good care to a patient, gets them what they need, the patient what they need. A great nurse has that human component. They realize that this is a whole person with a life, and make sure that they go above and beyond just passing of the medications and checking of the vital signs. They actually have that human component, and remembers that this is it could be your mother, your father, that you're caring for, and so they don't forget that piece. There is a huge human component to it.
Yeah. On that note, when patients walk into a hospital or another care setting, what do you think they notice first? And how can nursing shape that experience, positively or negatively?
Right. I think they notice how they're treated immediately. Do the staff smile when they come in? Are you greeted in a way that makes you want to be there? Do you feel comfortable? Do you feel safe? And nurses play a huge role in that, right? When we round on patients, when we come in and we ask them more than just how are you feeling today, but who are they as a person? Try to find things that are important to the patient beyond what it is they came there for. Those kind of small things make a huge difference in whether or not I feel safe in the environment.
Is there something you were taught early in your nursing career that you've since learned to approach differently? And why would that be? So
what I learned early in my career is that, you have tasks, and those tasks have to be done. Those are the kind of things you learn right out of nursing school. And what I learned very quickly was it's not just about the task. The task will get done, but you have to take the time to really listen to the patient. Listen to what they're saying are the issues and their concerns, and then address those concerns. So it's not just about how efficient I did at passing all my meds today. Did I take the time to listen to the patient? Yeah. It's important. Yeah. We're sharing a lot of important nursing insights in this conversation, but we know that not every patient and not every potential patient is going to listen to this podcast. So on a daily basis, how do nurses make sure the kind of information that they need reaches them? Yeah. I would say one of the things that we try to do for our patients is to encourage them to sign up for MyChart. When a patient may not hear every single thing that's said during the course of their stay, but everything that happened and transpired during their stay is in their medical record. And they can access that at any point in time during their hospital visit, and they can also access it once they leave. So I think that is a very important component, and really helps, to lend to the patient's understanding of what transpired while I was in the hospital. So let's pivot a little bit to the topic of technology and AI, because technology is becoming a part of everyday healthcare. Absolutely. But as a patient, you may wonder, what's in it for me, or what does that mean for me? So what would you like patients to know about how technology and AI are shaping their care? Yeah. Well, there are a couple of things. One big one is MyChart. We have that accessible to patients throughout all of Trinity Health. So patients can go into their medical record. They can communicate with their provider. If there are things they're thinking of in the middle of the night and they want to send a note to their provider, they can do that. And that technology is beneficial to the patient as well as the staff, as well as the physicians, the nurses, and is really a great advantage for the patient. I think there are a lot of things from a technology standpoint that we have in place that allow us to get information faster for our patients, but it still doesn't take away from that human piece that the nurse brings at the bedside. Which is what patients will remember, I'm sure. Absolutely. But how would you say technology is helping nurses spend more time with patients instead of less? Yeah, actually it really does. So at Trinity Mid-Atlantic, we have virtual nurses. And so those virtual nurses are another resource, another layer for our patients, and it allows that bedside nurse to spend more time with the patient. And so the virtual nurse then in turn does some of the more technical clerical skills to allow the bedside nurse to spend more time with the actual physical patient.
Yep, that makes sense. So we're going to pivot one more time to the future of healthcare, but for patients.
Okay.
So when patients, not industry leaders, think about healthcare, they're often looking for reassurances, not buzzwords, right?
Right.
When you look at this year and next, what do you see coming down the pike that you think patients will notice most in terms of how care is delivered?
I think what patients are going to begin to see is more resources in the community that are available to them, not just from a physician perspective, but from a technology perspective that are available in the community, quite frankly, to keep them out of hospitals, to provide more care locally. And then you'll have hospitals there and available to them when they need those kind of more advanced services. I think that is a lot of what patients are going to see is more offered to them in the community.
Care where they live.
Care where they live. Care closer to home. And I think that's extremely important. You know, as you know, Trinity Health, you'll see us providing more and more services out within the community. That's a part of Trinity. It's a part of our whole umbrella. And then having the hospital there as sort of that buffer when patients need it. But when you're trying to mitigate things like hypertension and diabetes, you want to have those services close to home and easy for patients to access.
Yeah, that makes a lot of sense. As you look at the care you and your team provide patients, what do you hope they remember the most about their nurses?
Yeah, I think the most important thing is that they cared. They cared deeply about what was happening to them, not just clinically, but personally. You know, how did you feel when you were in my care? And a lot of times that's what you'll hear patients say when they send a note back, whether it's, you know, a handwritten note or an email. They're telling us it was how that nurse made me feel while I was there. It is so important.
And again, kind of in that vein, if you could leave listeners with one takeaway message from this conversation about nursing care, what would you want them to remember?
That they are champions for you. Nurses want the best for you. They want you to get in, they want you to recover, they want to provide efficient, safe care in a safe space. So that way when you leave and go home, you realize you were taken care of by someone who really cared about the outcomes that you had.
That's perfect. Thank you, Leanne.
You're very welcome.
Thank you very much for shedding a light on this topic.
Thank you for having me.
Very important.
Thank you.
As you can tell from the conversation we had today, Leanne is not only committed to her field, but to the greater community. If you would like to follow Leanne's journey and her role in Trinity Health Mid-Atlantic, click the link in the description to stay up to date with her blog series, Letters from Leanne. Thanks for joining us on Beyond the Stethoscope. Don't forget to hit the thumbs up and subscribe to get new episodes every other Thursday.